Let's be honest, parenting can be messy and hard, but also so rewarding. In this podcast, we'll share all the ups and downs of parenthood, as well as share some of our favorite tips and tricks for parenting using both our experiences and expertise from our professional lives as a speech and language pathologist and teacher, but also our everyday lives as moms, just trying to balance it all. We're so glad you could join us.
This episode you're about to listen to is a topic that's very important to us. This month is Mental Health Awareness Month. We have spent our careers supporting children and their families struggling with mental health and believe that one way to break down the stigma around mental health is to share our stories.
The content you are about to hear is the personal story about a family and their journey navigating mental health. While this may be difficult to hear and may be triggering for some, it's important to discuss and know that no one is alone in their journey.
Hello and welcome to And Then We Had Kids. I am Jenny.
And I'm Sheena.
And I just feel like, again, we just have a great streak of getting people on our podcast to share their stories and like from all over, right? And so this month, every month is something different in regards to like bringing awareness. And actually May is kind of special because it's Better Speech and Hearing Month. So from me being a speech language pathologist, like I love May of just being able to share like topics and things like that. However, it's also Mental Health Awareness Month, and that is something that we can always talk more about. I think as the pandemic hit and a lot of people had to deal with emotions that they were sitting with in a situation that none of us had ever experienced before. It really brought about the importance of being able to talk about emotions, talk about mental health, talk about what's going on, not only with ourselves, but with our kids. Like we talk a lot about teaching emotion and vocabulary with young ones, but then, those kids grow up, they become teenagers, they become young adults. So we have someone on our episode today, Susannah, who is also a really dear friend of ours. She is an assistant principal, and we met her when we all worked at the therapeutic day school that we reference so often. So Susannah, welcome to our podcast.
Thanks for having me. It's a pleasure to be here.
Yeah, so Susannah,
and
go
fun
ahead,
fact. No, I was just going to share a fun fact that when we were working all together, Susannah started out as a teaching assistant, went back and got her teaching certificate. And I had the wonderful privilege of having her as my amazing student teacher.
Stop. Keep going.
No, you were the best.
Keep going.
Okay.
We can. I feel like I was writing down notes about this, even though I don't really need to. I mean, we've known Susannah for, I don't even know how many years.
I don't even know how long we've all been friends.
Like maybe like 7 or 8, like truly, I didn't do the math, but
I started at the therapeutic school in 2010. So we've known each other for about 12 years.
12 years.
Oh, geez Louise. But in that, like I was writing down notes, and Susannah's just someone who from mom to mom, like I truly respect her from day one. Like, so Susannah has 2 boys. In my mind, they're still like 12 and 8, even though that's not their ages at all. They're older now, but she like Sheena said, like she started off as a teaching assistant, like worked her butt off to get to where she is and has deserved everything that's come to her along the way. Like she's just an incredible person. I can't speak like enough about Susannah. But yeah, as a mom, like as someone, I want to like emulate how her boys are with her, like their openness, their relationship. It's definitely something to strive for.
So jumping into Mental Health Awareness Month, and the reason we asked Susannah to come on for this episode is obviously Susannah, and we all have this experience in terms of helping our students learn to manage their emotions, navigate coping strategies. But this has hit a little bit closer to home for you, Susannah. And so we were hoping you could share a little bit about yourself, your journey to parenthood, and why Mental Health Awareness Month really just resonates with you and your family.
So I've worked in special education going back to 2010. And as you know, a large part of that is working on that social emotional piece and working in different educational settings, working with a lot of students who do struggle with mental health, depression, and anxiety, and students with autism. And that comes with coping with so many different kinds of emotions. And we teach others how to use them.
Yep.
But it did hit close to home. I have a 19-year-old and a 17-year-old, both boys. And at the beginning of the pandemic school year, so my son's senior year in high school, he came to me and just said, Mom, I need to talk to you. And just, I'm going to try and get through this without tears. I'm making no promises, though. I might get a little emotional.
And that's okay.
Yeah.
Because a lot of it is still very fresh.
Yeah. And I think it's important for our listeners and for people who are navigating this themselves to understand just the raw emotions behind it. And, I loved your shirt the other day. It's okay to not be okay. There's a coffee shop in Chicago, the Sip of Hope, that really focuses and does a lot of awareness around mental health supports, being okay with your emotions. So I think if the emotions come out, we're just gonna roll with it. We're gonna support you in the conversation. But it's the reality of
mental health.
And
to keep talking about it.
And it touches, it's really a testament to how many people it touches too, that the person who is struggling with it is not the only person that is dealing with it and touching with it. It really stretches.
Right.
So beginning of my son's senior year in, August, he came to me and just said, Mom, can I talk to you? And that's like, as a mom of a 19-year-old boy, you're like, oh boy, this
could be any number of things.
Yes.
Yes.
It could be like, okay, but this is serious. This is
right.
Serious. So I remember going into his room and he just started crying.
Yeah. Wow. Then that he could, the fact that he came to you, you laid that foundation work for him to feel comfortable to come to you. So like I said earlier, like the relationship you have with your boys is incredibly special. So, and I feel like you've always had that open line of communication. You definitely, like, your background of being in special ed helps, so like you can kind of attune to that a little bit more. But the fact that was like his step to like come to you, and he's like a really social guy, right? Like
very much so.
He's such a cutie. Like he's super social, like athletic, like bright, has everything.
Super responsible.
Yes. Like just overall, like an incredible kid.
You have done a phenomenal job with those boys.
Thank you.
So
thanks for letting me like regroup in that moment.
Yeah, of course.
He said, Mom, I think there's something wrong with my head. And I just remember saying, okay, like, just talk to me about that. Like, tell me a little bit more about what that means. And he said, I just, I have thoughts about harming myself, and I don't know why I'm here, and I don't value myself, and I don't know why. I have parents that love me, and I have everything that I need. Like, I haven't, there's been no trauma. There's like, I've had everything that I need. I don't understand why, but it's been getting worse. And, we sat together for just a while, and I just let him talk, and I just listened. And, as a mom then, and with my background, I jumped into action of, okay, the first thing we need to do is get in touch with the doctor. Let's go talk to the doctor. Let's get in touch with a therapist, and start working through these things. Let's talk about the structure at home, where my sons were going to school. They were starting off the year remote learning. So I also knew that the isolation that we had all been experiencing, how much of an impact is that having on his mental state? Is it being exacerbated because of the pandemic? And as things open up, will things get better? Just so many questions that you have as a mom. And also that, what did I miss? What have I missed? This isn't new. He expressed that he's been feeling this way kind of for a couple of years. So what did I miss?
Wow.
And I think I'm so grateful in that moment for my background in knowing what steps to take. Because I think, to no fault of anybody, there are just people that they don't know what to do next.
Yeah.
Right.
So I'm grateful for the background that I have in working with students and families in this area and knowing what resources are available.
Yeah.
So we started therapy. We went to the doctor, low dosage of medication, and getting into therapy right away, and really developing routines and structures at home to help with that remote learning. I was working from home as well, trying to be as active as possible. Just all of those kind of step one intervention areas, checking in with him all the time, making sure that we were doing things as a family, that he wasn't isolating himself more, continuing to talk about it. And, you think things are going okay, or they're getting better. And he was also presenting in a way that was, oh yeah, I'm feeling better. I think the medicine's working, the therapy is working. But it wasn't.
Yeah.
And the week before Christmas, he walked into the kitchen and he had his shirt off, and I noticed cuts on his chest, on each side of his chest. And I, again, just very calm, and I asked him what the cuts were, and he said, oh, the dogs, we were playing, the dogs must have scratched me. But I very clearly know the difference between dog scratches and self-harm. So he went to take a shower while I kind of processed things. And when he came out of the shower, I just said, kiddo, I think you need some more help.
Yeah.
And he looked and he said, yeah, Mom, I do.
Yeah.
So I said, I started making some phone calls to just some therapist friends that I know. And I think I reached out to you guys, just of the hospitals around, where would be the best one to take him. As far as you knew, like if he needed to be hospitalized, which places were going to have the best programs. And so we got in the car, and I, in that moment being pandemic, I was concerned then as well. He's 18 years old. Are they going to let me go in with him? Because I knew at that time being 18-year-olds, that's a sticky age when it comes to things like this, because they cannot share anything with me.
Yeah.
Fortunately, I have a son who signed off on everything, and the communication was very open. I called the emergency room ahead of time and explained the situation and said that I was coming in, and I just needed to know ahead of time what to expect when I got there, because if I get there and I'm turned away at the door, I'm not going to handle that very well.
Yeah.
And they said, based on the circumstances, even though he was 18, they would allow me to go back with him. So, we went back. He met with a social worker, and, we talked it through together. And ultimately, there was a joint decision made to remain and go to an inpatient program.
Well, and think about you're familiar with this area. You know what I mean? You had friends that work in this area that, again, the resources. I'm just even thinking in my head of the parents out there that are navigating this, that aren't aware of the resources and don't have those kind of inside connections, and how, I can, see how hard it was, and still is for you guys, but also how hard it is for all of those families that don't know what's available out there.
Yeah. Those are things that I try to share. I am extremely open about this entire journey with my son's permission. And he's also very open about it, and sharing those resources and what we've been through to help other people. Because it's
in this moment, like you even like in this moment have choices to continue sharing or to shut down. You know what I mean? Like you can easily tell us right now, you know what, this is too hard and I can't, or I'm not going to. And you being so vulnerable, your son being vulnerable, willing to share, is the key reason why we have to. And just going back, like you've done things like at the beginning, validating his feelings when he came to you, and didn't just brush him off and say like, no, buddy, you're okay. Like, you're really fine. Yeah, everything's good. Everything's great. Like, just throw some positivity on it. You heard him out. And then when he was putting on that front, you had that, I assume, like, that mom gut instinct of like, no, I'm going to go check and see. I'm going to go ask that direct question instead of kind of just taking what he's showing me for face value. To then be able to get to the steps of where you guys are now and being able to talk about it now.
Because our kids will do things. I look back and, I don't know if he came upstairs without his shirt on, intentionally or not, but our kids cry for help. They cry for help, and we need to pay attention. We need to pay attention. And, leaving my child in the emergency room.
Yeah. So for people who aren't familiar with what you said, like inpatient in, so you took him to the emergency room, and obviously they're going to provide recommendations for whatever level of care your son or your child might need. And so for your son, it was inpatient. So that's where he stays there overnight.
Right.
Other programs, he's allowed to, he might be there during the day and then go home at night. But inpatient, it's really, really an intense level of care where your child is there overnight because they need that support around the clock, and being able to make sure that they can stay safe at that time of this crisis.
Right. And that's really what it is, because in that moment, it is a crisis moment. And, as hard as it was to leave, that he went in an ambulance and was transported to to another hospital. And for me to get in the car and go home by myself was extremely difficult. However, on the flip side of that, I knew that he was going to be safe. Because that's what was most important in that moment and in that time of crisis, was safety. And I, as his mom, I knew that my capacity to keep him safe 24/7, that's not my area of expertise in that moment, in that crisis moment. I knew he was going to be cared for. I knew he was going to be safe. And I knew that in that moment, that was the best place for him. And what was helpful is that he agreed. It was nothing that has happened has been forced upon him. He's voluntarily wanted the help, which I feel very fortunate about.
Right. That's not always the case, even though like then as parents, like, what your child needs. And I would imagine that him being 18 then would be so much harder. And that does happen. That's some people's story, is that the help that somebody might need and they're not getting it right now. But your son is, again, I think I know it goes back to how you've talked so openly about emotions, things that are happening, challenges, difficulties, successes, all of it, that he could recognize within himself, like, all right, like this isn't how I want to be.
He was in so the inpatient program for about 5 days, and then came home from there and stepped back then to an outpatient. So he would go to a program during the day that he would get that one-on-one therapy, continue to work on those coping skills, some group therapy.
Mhm.
So he did that for a period of time, and then stepped back to like evenings, like 3 or 4 days a week in the evening. So a gradual step back to really work on those strategies. A lot of interaction between our whole family. We did family therapy sessions, and that really helped facilitate some good conversations between our son and us as a family, in really giving him space to communicate what he needs from us. What are things that we are doing that he would like to see changed? What are some things that he needs us to do, in the way that we communicate with him? It also provided us a space to communicate what are our continued fears and concerns as parents, in that, you know, we want to make sure that you're safe, and we also want you to feel good about yourself and valued, and that you do matter.
Yeah.
And so that, I think people can look at some of these programs that are available, and they're very stigmatized.
Yeah.
And we as a family found it so helpful and so incredibly supportive at all levels, at supporting our son individually, one-on-one, in supporting us as a family together, in supporting just us as parents, having side conversations with just us as parents. Nothing felt judgmental. It was truly, truly supportive. And our son, he gained some really good skills there. We were still in the pandemic though, still in remote learning. So again, he kind of graduated, for lack of a better word, from all of these programs. We have, again, good processes, really good communication, talking, laughing, smiling. You know, we did go through some medication changes. Medication is tough. It is tough.
Yeah.
It's, you know, that research shows that medication with therapy is key. But medication is tricky because not everybody responds to medication in the same way. We went through some increases, some changes completely. And he kept saying, you know, I'm not feeling a whole lot different. Like in all of these programs, you're feeling good because you have all of this support.
Super intense of like the
Yes.
wraparound services
Right.
are all there. You're in this like super safe space. Yeah.
Right. So when you're done with that, and we were still doing therapy once a week. He would have some individual, and then his dad and I would jump on, and we would do family along with his brother sometimes. So that was ongoing, but he just kept saying, the medicine along with everything we're doing, I'm not feeling any different, which in turn was making him feel worse, because you have people saying, you're going to be feeling better. You're going to be feeling better. And when you're not, it was having that opposite effect on him.
Yeah.
And, so this was, I don't know, maybe February, March or so. And then April, I had started to go back to work. I had to be in the building. But my son's district was still remote. So they were hybrid. So some days in person, some days at home. And I was at work, April 5th, 2021. And I got a text from a friend of his.
I remember this, Jack. Yeah.
Yeah, I do too.
You remember it very well. We remember. Yeah. Yeah.
They're not even our boys, but in a way they are. Like,
Yeah.
Saying, hi, I'm really worried. I've been I got a text message saying, I love you, bro. I'm sorry. I just can't do it anymore.
Oh gosh.
And
And how, not even that you have this open line of communication with your boys, but the fact that I think, and I've noticed this too,
Yeah.
your boys' friends all
yes.
know that they can come to you.
Yeah, my son.
You're like mama bear to all of them.
Yeah.
Yes.
There are some perks to that. I was, my son was a wrestler in high school for a couple of years, and I was called mom by a lot of his friends. They were at our house all the time, and I did develop really good, close relationships with them. And I always made a point to have contact information of my son's friends, just in any emergencies. If I can't get a hold of him. So in that moment, I was so grateful, grateful. I was so grateful for him having such a wonderful friend that didn't just pass it off and whatever, he took it seriously and he reached out to me. And so my other son and my stepson were also at the house. They were all remote learning. My husband and I were both on our way home from work. So it's such a blur, but I know that, we called 911, and in that moment, having to ask my son and stepson to go to the basement to check on my older son was terrifying, because I had no idea what they were going to see or find. We were on the phone with them the whole time. I have a really good relationship with my ex-husband. I had gotten on the phone with my ex-husband and said, you have to get over to the house right now. Fortunately, he lived about 10 minutes from me. So he was, everybody was on their way. Ambulance was on their way. We were on the phone with son and stepson, just calmly. These put the dogs outside so that paramedics can come inside. What's going on? Talk to us about what's going on with your brother. Is he breathing? Is he talking? He said he was, it looked like he was sleeping. He was breathing, but he wasn't really responding. He would wake up a little bit and then kind of fall back out. And so we were just really talking them through, try to keep talking to him, try to keep him awake. The ambulance should be there. Your dad, to my son, is on his way. So we were all just kind of on the phone, talking them through it. The paramedics got there. I didn't even get home before the paramedics got him out. And so we ended up meeting them directly at the hospital. He had taken all of his prescription medication.
Wow.
And afterwards we found he had been keeping a journal, and we found, and he wrote exactly, if somebody finds me, this is how many I took of this. This is how many I took of this.
Wow.
Worst day of my life.
Yeah. I mean, again, like you're seeing those signs of like kids crying for help, and like the fact that he wrote that down. Wow. What, like, and again, the brain is such a tricky beast of like the highs and lows it can really cause you. And I think just reflecting on what you were saying of like, he's gone through so much already, and to think that I'm not quote unquote better must have been like hurting him so much. I mean, just thinking about when we go through even smaller things of just like, why don't I feel better? Why don't I feel good? If I'm doing like A, B, and C or X, Y, and Z, everything should be lining up and be so linear. Mental health is so not linear.
Right. And he, it was a whirlwind at the hospital. Again, pandemic, we couldn't go back. They were very, very supportive and kind and gentle with me as crying, concerned, worried mom. I'm asking
Right.
all kinds of questions. He was stable. He was just very, very in a very deep sleep. And it took him a couple of days to even really come back to that level.
Yeah.
They let me sneak in overnight and spend 30 minutes with him.
Bless their hearts. I mean,
Yeah.
they should.
That was also
it's just so hard, but.
And I think for people to remember too, it was the pandemic. So
Yes.
not only is this, when someone goes into an inpatient psychiatric unit, there are a lot of restrictions in terms of visiting hours and what you can bring and what you can't bring. But then to add the pandemic on top of that as a whole nother layer.
Well, this was just the emergency room.
But I think even people who are going, Jenny and I both gave birth in a pandemic, and my husband wasn't allowed at any of my doctor's appointments. That was just a pandemic precaution. Right. And then you add just the other layers to this. I can't even imagine.
So we went through, and as a mom, I'm thinking, what am I doing wrong?
Right.
Yeah. Same for you. I mean, yes, we've been talking a lot about what your son's been going through. You are such a person when you're like, we know you, right? Like if you're given task of what to do, you're going to do it. If someone tells you a recommendation for your child, like we said, you're a mama bear, you're going to do it. A lot of people, when they're given these recommendations for, continue with therapy, do family therapy, it's kind of easy to, when you get into a good spot, to say, it's all good. I don't need this anymore. Yeah. But things are going well at times because all of those supports are in place and need to stay in place. So again, you also are doing everything that you have been told that's going to help get your son to this place. Mm-hmm. So, I mean, I feel like we have toddlers, Sheena and I do. We feel mom guilt when my kid doesn't get a French toast stick. The guilt I can only imagine is incredibly exponentially so big, in your stomach. I couldn't even. So yeah,
because it's
so hard for you.
I felt like and it's not about me, right? But
right. Yeah.
But I felt I thought we're doing everything right. And we're not just going through the motions. I mean, every person from my son's aunts and uncles to grandparents to, myself, his dad, step parents, the brothers, the step brothers, this kid has such an amazing support system, but that really goes to show you that the brain and mental health, those things can all be in place and you can still struggle.
Yeah.
And that's because that's just how it is.
Mm-hmm.
Yeah.
And I think this was really the point that things kind of turned a corner. We went back through the process, the inpatient, again, for that stabilization and safety. He went back through the same intensive outpatient program, still lots of therapy. But I think because that rock bottom had hit, we could really dive really, really deep into the why.
Mm-hmm.
And there was nothing else he felt he needed to kind of suppress or keep from sharing with us. And through some different family therapy sessions, he was hiding a lot in because God loved him. He knew it would make us sad. To share. Yes. I know that if I'm not in a great place or I'm struggling, that it's going to make you sad as my mom. And I don't want you to be sad as my mom. Yeah. And so it was really reframing that, oh my gosh, that's amazing, but I'm your mom and it's not your job to protect my emotions and my feelings. Mm-hmm. It's not, you don't have to do that.
Yeah.
I can handle my emotions and my feelings, and I just need you and want you to be as open as you possibly can be. And that really became the focus of that super, super, super transparency, and understanding too that, and reasonably so, there were times he felt like, oh my gosh, mom, like you got to back off.
Right. It's like, how do you find that balance?
Right. Of me as a mom wanting to make sure he's okay, that he's that physical safety, the mental safety, his social, emotional health, that it's all working together. And it is finding that balance of, if he says he's okay, and through therapy, I had to learn, if I am asking very concrete questions, are you safe? You're telling me you're not in a great place right now, but are you safe in your body? And you tell me yes, I have to trust that. I have to trust that. And I can't, are you sure? Are you positive? Like that's not helpful. And the more he knows that I am trusting what he's telling me, the more open he can be about that. And we would use a rating system, like a 1 through 10 we used a scale on where he is, and finding his baseline. Like, I kind of live at about a 4, so that's my normal. So if I say that I'm at a 6, I'm actually doing pretty good. So it's really developing those systems of communication that let him feel like I'm able to communicate where I am without you being worried. And it's enough for me as a parent to feel confident that, okay, he is truly okay. And really listening to what he's telling me. Continuing to work on those coping strategies. We did finally get medication correct through saliva testing.
Can you, we obviously know as your friends what this entailed. And I remember having a really in-depth conversation with you about this, but I feel like this is one thing that like I had kind of heard of for other diagnoses that people were navigating and trying medication with. But I don't know that this is as well known. So can you speak to this specific testing that he went through that led you to the right medication path?
Yeah. So, we were continuing to have these medication challenges, and I was struggling more and more with, is it more detrimental to be change this, adjust this, take this away, add this? Because that can't be good for him.
Right.
And I had heard of this saliva testing called GeneSight. This is not a plug for GeneSight at all, just what the path that we decided to take. And I brought it up to the psychiatrist one day in a family therapy session. I said, I may sound like an absolute lunatic.
I Googled this. Yeah.
Right. I apologize, but I've been told about it and I looked it up. So I'm just curious as to what your thoughts are.
Right.
And I said, I have heard about this GeneSight testing. It's a saliva-based testing. It can really help determine what medications the body is responding to and what they will not. And he said, it's actually really interesting that you mentioned that. I was going to bring it up because we have not had a lot of success with his medication. This would be a good next step to kind of try and figure out why. So we did move forward with that. And it basically breaks down medications kind of in a red, yellow, green zone. Green is as prescribed in different, like your mood disorder, your ADHD, your depression, your anxiety, kind of broke down the different types of medication. Green is as prescribed at the dosage, your body will respond well to them. Yellow is your body may respond to these. You may need to increase or decrease dosage slightly. And red is be careful with these. It's going to be more difficult for your body to metabolize these, to respond to these medications. Through this testing, we also found that he has a deficit of, oh my gosh, I can't, and I know I have it right here in the drawer. He has a deficit, I can't remember, it's going to drive me crazy. I can't remember what it was. Whatever it is, his body does not absorb medications well because of this something that his body is not producing.
Right.
Yeah.
Which
is it like a hormone deficiency or
was it folic
Yeah, no, it was folic. I do remember that.
folic acid, something
Yes,
like that. Something
it
like
was
that.
folic acid.
So that he does not produce enough. So his body does not metabolize medications all the same. So I was like, okay. And that is addressed through, he takes B2 every day. It's a vitamin.
Yeah.
He just takes it to help with that. So in looking at the medications that he was currently on, we saw that some of these, one of them was in the red.
Wow.
And a couple were in the yellow. And so we really started looking at the medication and leaned towards those yellow, not bad, but let's make sure we're adjusting the dosage appropriately. So based on that information, we did a complete overhaul on medication. He would do weekly blood tests to see what his levels were to find those correct levels. And we got it right. We got it right.
Incredible.
And again, not the end all be all.
Right.
The intense therapy still continued. And I really think the basis of all of this came from my son getting to a place that he hit bottom, and he did want help. And I remember him explaining, because afterwards we were, I don't want him to relive it, and I don't want to rehash it. A lot of it he does not remember. He can't remember. He said, Mom, I was just so tired and exhausted.
Yeah.
Of constantly fighting the thoughts, constantly fighting the thoughts in my head. And I just thought, I knew you would be sad, but I knew that in time you would be okay. And as a mom, you're thinking like, no, I would never be okay.
Right.
I wouldn't know how to recover from that.
Right.
And that so I kind of want to fast forward a little. I've been a little long-winded. He is finishing his freshman year at Bradley University has made the dean's list.
I mean, incredible.
Each semester he continues therapy.
Yeah.
He can, with the same therapist, they've developed a really good relationship. We do family therapy sessions. He still struggles at times. He still struggles, and we will get on the phone, and I can tell when he's not in a good place, but he's now in a place that he can communicate to me, and it's so powerful. And I'm so proud. So he's been diagnosed with bipolar 2. The insight he has into himself now, even from a little bit over a year ago, he says, Mom, I can feel it coming on, and I know what to do now. And the thoughts still come, but I know that they're temporary, and they used to consume me and control me, but they don't consume me and control me anymore. They're there. Sometimes I do still question, like, what is my worth? Like, what am I doing? What am, and
hey, buddy, but like, that's amazing.
But he has that insight, in that he can communicate to me and help me understand that, Mom, when I tell you, like, I don't see the purpose of life. I don't really value life over death. You don't need to be afraid of me saying that. If I'm not communicating that with you, then that's when you worry. Because as long as I'm communicating it to you, I'm okay, because I'm talking about it and I'm getting it out. And that's part of me being able to just move on and move past it, because I do know that it's temporary, and that I might be in a low place for a week or two. I mean, it's been as long as maybe 3 weeks.
Yeah.
I know that it's coming to an end, and that I will be fine. He's really, he knows that being around people is what he needs, being around his friends and not isolating himself in his dorm room. We talk on the phone, we text. So it really, really comes down to that open communication and really listening. And it's uncomfortable as a parent sometimes to hear what your kids are saying and the things that they feel about each other. So not taking that as a reflection of me, but just hearing him and listening, and just as simple as, what do you need from me? Is there anything that I can do for you right now? And sometimes it's no, I just needed to get it out to, I need to come home this weekend. I made a trip there one weekend. It's only about 3 hours away. And I took our puppy down there because I knew he was not in a good place. And I knew as a mom, I needed to go down there and I just needed to spend some time with him and make sure that he was okay. And sometimes that's all they need. So it's been a journey. It's still going to be a journey. He understands this may be a lifelong journey. He's hoping that it's not, that as he continues to grow and learn more about himself, that this is part of who he is. It's not his identity anymore.
Yeah.
Well, and I think of obviously we know that you guys had a wonderful, trusting relationship and that open communication, but how much that has blossomed as a result of this.
Yes.
Like I remember him getting ready to go to college last summer, gosh. And again, just as your friend, my own fear and panic of, oh my gosh, him going away to college, right? Like, I'm like, I'm freaking out and it's not even my child. And that speaks to, I think, just also our friendship that we worry about each other's kids.
And we had to talk through school.
Yeah.
That is, he left for school in August and this happened in April. That's not a lot of time.
Right.
Yeah.
To go from an attempt on your life to leaving for school. And we really talked about, is this what's best for you to go away right now, but still wanting to honor that taking that step. And so we really, with the therapist, talked through what are our fears as parents and him acknowledging those fears. And so what's our communication going to look like when you're away?
Right.
What's a reasonable expectation I can have as a mom for a freshman in college? Like,
how much am I allowed to text you?
Right.
Can I just show up at your dorm room?
Right. That's right. Right. Saturday night, where's the party? Can I come?
I'll go. Yeah.
So really kind of outlining that and him expressing, what is he worried about? Because there were things he was concerned about and worried about, and just talking through them. And I think that it sounds so simple, but it really is complex. The communication, the being able to listen and not just having the solution, telling them what to do, how to fix it, because you can't fix mental health. You can support mental health. You can be there for mental health. You can understand, you can empathize, but you can't fix it. And that is hard. I am a fixer. I am a fixer in all areas of my life, at work. And I can't fix this for my son.
Yeah. And as a parent, all we want to do is fix things so that our kids are happy and content and whatnot. The other piece I think of is, when he's at home, he obviously has this family there to support. And we know that he has wonderful friends at home. But I think that this also speaks to the fact that he knows how to pick good friends. To create that support system there. And I think people can say what they want about fraternities and sororities and Greek life. And there are plenty of times where they're in the news and not for great reasons, right? I think I even probably saw one today or yesterday, but say what you will about that. He joined a fraternity and it's been a really supportive network, at least from what you've shared.
Yeah. I think it's helpful for him because he's open about it.
Yeah.
He talks to people about it. And I think that's really powerful because, and I have a friend's contact information from Bradley as well. Because I'm going to have a contact everywhere because as a mom, I'm going to make sure that you're safe. And if I can't get in touch with you, I'm going to get in touch with people that can.
Yeah.
Mhm.
And
I'm sure those frat boys are partying it up down there at Bradley,
Oh,
but
They don't. They're
no.
so good.
they're just always at the library studying.
studying,
But-
reading books.
But they can have fun, but also just be that support system that he needs there. You know, like it's his family away from home.
And they wrap around him too. He's
Yeah.
like, they will notice when he's not in a great place. And other people have opened up to him about their challenges and their struggles.
Wow.
And he got a nickname and a t-shirt from the fraternity that he had joined, and his nickname is Survivor. And
Oh my gosh.
he got a tattoo, his first tattoo. It's a gravestone with a crack in it, with the date of his attempt on the gravestone, but butterflies and flowers coming out from behind it. And while it comes with sadness, it's that new life that came from that day. So again, really, the message is just so powerful, and it's hard and it's sad, and I still cry, and I still worry, and I still panic.
Yeah.
But I look at where he started and where he is now and where he'll continue to go.
Yeah.
And I'm more confident now that he has the tools, he has the strategies, he has the support, and he has the confidence, I think, to really be able to tap into those supports. As simply as, you know what, Mom? I am not in a good mood right now. I'm not in a good place. I am fine, but I'm going to bed and I don't really want to talk to you tonight. Thank you.
Right.
Thank you for letting me know. I'll check in with you in the morning. Like, that's important. And he wasn't there, and he is now.
Yeah. Wow.
I think that this
Um,
all goes back to the fact that we still need to talk about mental health, and
Yeah.
like him being able to share his story, even though he's not here. There's like a slight chance he was going to join us and just be able to share his side, which one day I think that would be incredible. Just because it can be so powerful, so helpful, so connecting, hopefully in some way so therapeutic to not only him, you, us, listeners. But like you said, it's talking and finding that balance of what does that communication exactly look like. So just hearing your story, it's still, this wasn't something that happened years and years ago. It's something that happened relatively recently. And like you said, I just thought the way you framed it as you can't fix mental health, but you can support it, is a beautiful way to look at mental health.
And I think anybody who wants to talk about mental health, I can talk or listen for hours, just because one, my background, to how close it hits to home.
Yeah.
And ultimately just helping people understand it from a parent perspective, from a child perspective, from a friend perspective, because I think a lot of times we don't know what to do. We don't know what to do or what to say. And sometimes just being there is all you need. And I think the more we talk about it, and let's just be honest, we see it in schools and just in society. Our hospitals are overrun with suicidal attempts, suicidal ideation. It's, we're in a mental health crisis coming out of a pandemic, but we're just seeing more and more depression and anxiety, and these, bipolar. And the more we talk about it, the more normalized it is.
Yeah.
And people don't need to isolate themselves, and they don't need to keep quiet about it, because people will be judgmental of them, because we're all battling something.
Right.
All of us. It may look different, but we all have challenges, and we're all battling something. So I think the more people know that, oh, you know what, there are a lot more people out there struggling with the same thing I am. Okay, this is okay. It's okay. And the shirt that I wore, it's okay not to be okay. I mean, I would wear it every day, everywhere I go if I could.
Yeah. Right. Well, and two, like our kind of target audience is moms, is parents, dads. Um, the how common postpartum depression or anxiety is, right? And how hard it is for new moms that are not only navigating these newborns that you've been sent home from the hospital with, right? Sometimes not even knowing what to do. And then your body's going through all of these different hormones. And just sometimes even questioning, like, what am I doing? But I think one of the things that resonated with me of what you just shared too was it's not always about the words. Sometimes it's just being there. It reminds me of that Brene Brown video on empathy, where I think a lot of times people have sympathy and they want to say these words to fix it, right? Or silver lining it, as she puts it in the video. But words aren't what fixes things. It's the connection that people remember and that relationship. So yeah. Wow.
And sharing with others around you too, that could we have kept this within our immediate family? Sure.
Yeah.
But I think it was important for him to know. His father and I are divorced. I am remarried. But all of us wrapping around him in the same room together at the hospital together, showing him that everybody is there to support. So keeping this quiet and keeping it just within the household, that sends a message too.
Right.
Yeah.
It sends a message too.
Absolutely.
Well, Suzanne, this has been an incredible story. I do want to ask one last question before we kind of wrap it up, but we kind of touched upon it a little bit, but what advice would you have for parents who are kind of at that beginning stage of like, I can kind of sense something's not right, but my kid or my child isn't as open as your son was? What would you say would be kind of like either a number one or a go-to, especially if parents, maybe they're thinking, maybe I'm wrong in it thinking this, and if I maybe quote unquote push them over the edge or something like that, and not feeling you have to walk around eggshells around your child, what would you say for parents?
I think then the number one, the first step there is creating a safe space for your child to be able to be vulnerable with you, whether that is taking them out to eat and just looking for those changes in behavior. He was lethargic and he was sleeping a lot. We were also in a pandemic and he's also 18. So I'm like, well, that's what everybody is doing. So,
yes.
But no, those small changes in behavior, if starting to isolate or not wanting to do things, opening up those conversations, hey, I noticed, you're not really wanting to go for walks like we used to anymore. Is that, talk to me about that. Making it comfortable, and it doesn't always need to, we don't want it to only happen in crisis. I also think reaching out, if they're a school-aged child, reaching out to the school social worker, to the classroom teacher to see if they're noticing any changes. If you started to have those conversations with your child, definitely contacting physicians and reaching out. Schools are a really good place to get resources. Your social worker will have references and referrals for local therapists, psychiatric evaluations, psychiatrists. These are all really good resources and good places to start to just ask the questions. Schools are a really, really good resource and a great place to start, but also those doctors, your doctors, your physicians, obviously going through your insurance to find out what's available to you.
Yeah.
That is really
a factor,
helpful.
Yes, right. Here we are. Let's talk about it in so many different ways. Yes.
Oh boy.
But I think the bottom line, that first step is really creating that safe space for your child to want to open up to you and feel that they can without judgment, without feeling that they're going to be in trouble for the way that they're thinking, or that they're going to be told, you don't have any reason to feel that way. Everything is fine. Why are you feeling that way? Because
or to feel ashamed.
Right. It's creating that safe, that's really, really safe space for your child to be able to open up and be vulnerable.
Yeah. Well, thank you again, Susannah. Any excuse for us to hang out and talk, even if it's on Zoom, we're going to take it. Again, your story is incredibly powerful, and we just really appreciate you sharing everything that you are going through and are still going through. And that I'm so happy to hear that your son is in a good place now.
Yeah. I think we appreciate your vulnerability and for him being open to sharing his story. And we're also proud of him.
Very. So yes, if you have, as a parent, if you're wondering, like Susannah said, we are going to put a little blog post up on our website, just to have some resources of where to think about getting started. So it's always a good time to start and to talk about mental health. So yeah, thank you for listening.
Thanks.
Thank you.
Thanks for listening to this week's episode. If you or someone you know is struggling with mental health, please reach out to your private provider, check out NAMI, the National Alliance on Mental Illness, or call the National Suicide Prevention Lifeline, 1-800-273-8255.
Thanks so much for listening. We hope you enjoyed this episode. And if you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and review. To catch all of the latest, you can follow us on Instagram @_andthenwehadkids. Thanks again. And like we say, life used to be carefree, and then we had kids.